For those of you who I have not had a chance to meet, I'm Kim Malsam-Rysdon. I'm the Secretary of the Department of Health, and it's been just shy of a year now that I've been in this role, and so I'm really excited to be here before you today to start us off down our path of the next Department Strategic Plan. So thank you again for taking time out of your schedules. I appreciate how busy you are and the important work that you do every day. This is our first chance to talk with folks about the strategic plan, and I know we've done some interim communications, and we'll talk a little bit about that as we go along here, but we're really excited about what we're going to be working on here in the next 5 years. We thought it was important for folks to refresh their memories around just how we're organized as a department, because you're going to start to see some of this come through when we talk about different strategies that we're going to be working on in the next 5 years. And so this is a really busy chart, but here you're going to hear things about the Division of Administration and our data, statistics, and vital records area, our public health laboratory area, which you're going to see reflected in our department's plan moving forward in some new ways. Our financial management area, which supports all of the activities that we do across our department. Correctional health, again, another area within our department that you'll see reflected in the plan moving forward. You'll also hear about some accomplishments in key areas, and one in particular in this area is relative to our health information exchange and some good work that we've done there. Our second division is our Division of Family and Community Health, and that actually sounds a little different than what it did here a few months ago. We'll talk through a change in that area. But within that division, we've got our disease prevention services, our child and family services, and then chronic disease prevention and health promotion. And you'll see those areas reflected well throughout the plan as you have in the past. Our Division of Health Systems Development and Regulation. I find it ironic that that's the biggest mouthful because it's our regulatory division, and that's kind of fitting, but that's our area of health protection, licensure and certification, and our public health preparedness and response areas, as well as our Office of Rural Health. So you'll see activities around healthcare workforce recruitment and those kinds of things, as well as our regulatory and public health preparedness areas really falling in that division there. We do also have a number of professional occupational boards that are part of the department. They have a lot of independence and function and have their own rules and regulations. And so our plan is really kind of about our divisions and the work that we do on that part of the chart. So where are we starting from? Well, we're starting from our current department strategic plan. Does this look familiar to folks here? I hope it does, and I hope that the new plan will become familiar to you as well and has really become a working document. But as you can see, we're really have been working in 4 main goal areas here over the past several years. And we won't belabor this, but I think it's important for folks to understand where are we starting from and help to understand where we're moving to. Certainly in the light, kind of the mint green area on the top left, improving birth outcomes and health of infants, children, and adolescents. That is a key part of public health. It's been a key part of a lot of the activities that we do across the department, and you'll see the importance of that come through in our new plan. In the pink on the top here, improving the health behaviors of South Dakotans to reduce chronic disease. Again, how do we lessen the burden of disease? How do we help people stay healthy, maintain their health, and minimize the impact that chronic diseases can have on folks? In the yellow down on the bottom left, strengthening our healthcare delivery system. That's where we're talking about how do we support providers to provide quality health care, how do we ensure that we have good workforce across the state to meet people's needs. And then finally, in the bottom green area, strengthening our response to current and emerging public health threats. Can't lose sight of that, and all of you appreciate that in your day-to-day jobs, I'm quite sure. So those are the kind of the 4 main goal areas that we've been working on and making some really good strides. A little bit more detail there. That would be the back side of the one-pager that I hope, again, you are all pretty familiar with. So let's talk about what we've accomplished here in the past year in these 4 goal areas. In terms of improving birth outcomes and the health of infants, children, and adolescents, how do we really continue to work on infant mortality? Infant mortality continues to be a very important issue in our state. We see some very disparate rates among different populations in our state, and we don't want to see any babies die before their first birthday if at all we can prevent it. And so, how we help educate parents, how we help support safe sleep environments has been an accomplishment of ours. This is also an area that First Lady Linda Dugard has been very interested in and has spearheaded a lot of our activities in this area, and we're very grateful for her leadership. We've also done some work around data collection. How do we make sure that we know what's going on in the lives of pregnant women so that we can help them have safe and healthy pregnancies? We've increased our immunization rate, and in particular our Tdap rate, moving from 70 to 75% between 2013 and 2014, and then our meningococcal rate from 51.7 to 57%. I was just, and members of our management team were just at a legislative committee meeting yesterday, and it was really important for us to have to explain that sometimes progress in the area of public health can seem pretty slow going. And that's from a lot of different factors. But when you see immunization rates change in the way that we have, we would call that out as an accomplishment. And so thank you to all of you who have worked to help make these happen. In our second area, our second goal area, some key accomplishments there. We saw over 2,600 women screened for certain cancers through the all-women count. We diagnosed 21 breast cancers as a result of that, as well as 3 cervical cancers, and that to those women could mean the difference between life and death. So really neat thing to see there. We continue to work to help with our colorectal cancer screening rates and in implementing evidence-based practices that work to increase those, not just things that sound good or feel good, but things that are proven to work. And so we've made some inroads there. We've also maintained one of the highest quit rates in the nation for our tobacco quit line when we measure that at a 7-month quit time period. And so we're seeing 41.8% of folks who have gone through the quit line that have quit, I think I'm saying that right, after 7 months. And that's a big accomplishment for those people due to the work of our staff here. In the area of strengthening our healthcare delivery system, one of the big efforts that we've had in the last year came out of a legislative change last year to transition the Office of Emergency Management Services from the Department of Public Safety back to the Department of Health. That's kind of where the home was for these services many years ago. And so with that legislative change and with the executive order that the governor signed, Tom Martinez, Hallie Lee, and staff in that area have worked very, very hard with stakeholders across our state to really look at what does this opportunity present for us? How do we make services better as a result of this change? And we'll talk a little bit about some legislative changes that are coming as a result of that work. We continue to make strides in how we recruit workforce and how we help entities recruit healthcare workforce across our state. Obviously, we can have the best services available from a quality perspective, but if people have a hard time getting to a provider, having a provider available, we need to work on those things. So we've expanded our REPS program, which is Rural Experiences for Health Profession students, to help get professionals exposed to rural practice, and hopefully they will stay and practice in those areas. This last area here is around our health information exchange, and that's where we've really been working with providers to help make healthcare information accessible for the provision of healthcare services. And that seems kind of wonky and seems kind of mundane, but if you've ever been a patient and had to track down your records to get to the next person that you need to see, we want to help make that easier, help reduce errors, and help make healthcare information accessible to providers in our state. Our last area, relative to our goals and our strategic plan that we wanted to call out some accomplishments, has to do with our response to current emerging public health threats. In the past year, we had to respond to an outbreak of measles, which we haven't had to do in a long time. I'll just tell you, I was very new on the job. I'm like 2 weeks new on the job. I think, I kind of thank God that I was so new, because I don't think I was adequately scared of what that could mean. I just didn't appreciate that. I certainly appreciate it now, and I appreciate the hard work that our staff did, especially from Sioux Falls and the Mitchell area, to go and talk to hundreds and hundreds of people to keep this outbreak from spreading. That was a great story to be able to tell folks about how that really happens in the real world. It's easy to read about things that happen somewhere else, but to be able to really portray the importance of the work that we do in this area was certainly a learning experience for me, and I was happy to share that with others. But we saw, that outbreak controlled, and I think, in very large part to the disease prevention staff across our state, and especially in those areas. So we also saw a need to respond to Ebola, and albeit a very small response in relationship to what other countries are having to deal with in other states. But we had to kind of come up on that issue and gear up to be able to, provide support to folks who were traveling from or coming in from countries where Ebola was a very real issue. So we successfully monitored 56 travelers from Ebola endemic regions. We also have been very active in pulling together groups and really leading planning efforts to respond to things that hopefully never ever have to happen. One of those kinds of things was, a potential large public health impact, from something like the Sturgis Rally. That was a banner year for the rally, and we were at the lead of really coordinating our planning efforts from the healthcare community perspective to be able to, be prepared for that. So a lot of great accomplishments here. I would tell you, as we were preparing this presentation for folks, we started with, a 10-page list of things. If you've not seen that yet, it's available on our website. Has a lot of good information, a lot of good data on the different things that we've all accomplished together as members of the Department of Health. And we just wanted to call out kind of some of the key things as they relate to our department's current strategic plan. So let's talk a little bit about the planning effort that we've gone through here over the past several months. We put together a work group of staff that you see listed here, and I just want to say first and foremost thank you to everybody that participated and supported this effort. It's I get the easy job of coming up here and talking about some of the great work that we've done, but it really was an effort of many, and I want to particularly thank Susan Sporrer, who is very humble and in ever calling out her role in these things, but really helped us as a group stay organized and stay on task, and would run things in and make sure that we were kind of doing what we needed to do to get our plan done. So thank you, Susan, for all your help with this. What you see here is, hopefully a good representation of staff across our department. We wanted to make sure we had staff from all divisions. We wanted to make sure we had staff from different locations, because I very much appreciate that things can look different depending on the seat that you're sitting in, and so we wanted to make sure that the plan really reflected the opinions and views of staff throughout our agency. So you can see we had a large group. We had several meetings, and really did a lot of work as an entire group, but also broke into some groups that worked on specific goals that we're going to go through here today. So if you're a part of this effort, thank you very, very sincerely. I just really appreciated the discussions that we had and the fun that we had, as much fun as you can have with something like this. So why do it? I think, we really wanted to, I think it's easy to say, well, that's what somebody else does, or that's, not really relevant to me. So we really wanted to share with you a little bit about why we went through this process and what the plan means kind of moving forward. I think it's really important, and I personally hold these beliefs very, very strongly, so you should know that about me, that it's important that an agency have a plan so that you know where you're going, so that you can tell people why is it important to work for the Department of Health, and why is the work that you do important to the people of South Dakota. If we can't explain those things, I think we're doing a disservice to ourselves, but also ultimately doing a disservice to the people that we're here to serve, which would be our state's population. Resources are always very tight, and that doesn't matter if you're talking about human resources, if you're talking about fiscal resources. We see changes happen federally that impact our ability to garner and use resources. So we're always kind of in this changing landscape when it comes to people and fiscal resources. A good plan will help us direct the resources that we have towards the goals that are most important for us to meet. And so it's very easy to get pulled in a lot of different directions when you have a charge like the Department of Health does. And our plan will really help us stay on track, use the resources that we have to meet the goals that are most important to us, and also look for opportunities for resources that we don't have today to direct them in a way that'll help us have good outcomes for folks. I also hope that it really helps us work together as a department rather than in our individual divisions. And I think that's very easy. It's very easy to just fall into this is what I do, this is who I work with, and I can kind of manage on a day-to-day basis in that way. But we've got a lot of strengths across our department, and our plan should really help us leverage those strengths so that we're working together as teams and not as much in silos. Obviously, the second point here is that it tells us where we're going. It's really a roadmap of our department in the future and help us to work together to meet those goals that we're going to be setting out here. Lastly, a little bit about the process. We had several meetings. I showed you the group membership there in the slide before. We had several meetings over the course of the summer and the fall. We did some work in between meetings to just get more information. One of the things that I appreciate about the department is our use of data and the way that we really have made data-informed decisions, really across our program line and across our daily decisions. So we wanted to make sure that we were working with good data. What does the data show us? Where does that point us? What do the staff have to say? And Susan's going to be here in just a minute to kind of share some results of that. What do external stakeholders have to say about the work that we do and maybe what their thoughts are about what we should focus on? So our group met several times and really looked at data, data from a variety of sources to be able to kind of come to the point that we are today. So with that, let's talk a little bit about some of the input that hopefully all of you took part in, as well as some others, about the agency's strengths, weaknesses, opportunities, and threats.
I am enthused to be here to talk about SWOT. Like Kim said, Kim just went over who our work group was, and clearly you have to have a smaller work group to accomplish what we needed to accomplish. But we also wanted to provide an opportunity for people to have input into the process as well. So for those of you who were here at the time, we had put together a Survey Monkey to have people respond to what people saw as the strengths, weaknesses, opportunities, and threats. And I think as we go through the strategic plan now moving forward, I think you'll see a lot of those things that we've at least tried to address in the strategic plan. As you'll recall, we put down a list of things that people could say. This is, mark what you thought mark as many as applied. So this is kind of the compilation of that. So just starting with the strengths in general. Also, the survey was sent to 494 employees, and we had a 57.4% response rate. So we had a pretty good response. So just in general, our strengths were our positive attributes internal to the health department. What do we do well? What advantages do we have? And what do others see as our strengths? And as you'll see here, our top strengths really are our workforce. We have a competent and professional workforce. When I talk to the work group, it's like, I'm awesome, everyone's awesome, and we should be happy about that. So our staff work together, and I think we see that all the time, that whether it's an emergency or whether it's just day-to-day activities, we work together well as staff. And we have a commitment to quality. So that's something to be proud of. I think when we get down to the things at the bottom that are not seen as strengths, I don't think any of this, it didn't come as a surprise to me. Communication, both from DOH leadership and then between programs and divisions. employee orientation was not viewed as a strength, and policy direction was not viewed as a strength. So, oh, I'm probably hitting the microphone, Patrick, sorry. So then moving on to our weaknesses. Again, we looked at, these are, what detracts from the value you offer? What aren't we doing well, and what can we improve? I think you'll see what weren't seen as strengths are coming across as weaknesses now. Again, communication, both from DOH leadership and between divisions and programs, and employee organization. I think, and this is where we start to see resources kind of show up too, that the weaknesses, we may not have enough resources either financially or staff-wise to do the work we do. So what weren't viewed as weaknesses was just a lack of common knowledge of where resources were located and interpersonal relationships. And then policy direction wasn't seen as a weakness either. So either we didn't know what policy direction was, or and I think a lot of these weaknesses, especially you're going to start, where you're going to see a lot of these issues addressed is going to be in Goal 5, which Joan is going to be talking about later, but kind of more of the internal things that we need to do better as an agency. So then we move on to opportunities, and these are the external things that impact the work we do, that can either influence or contribute to our success and outcomes. And I think this is where where you're going to see a lot of the work we do with our partnerships coming up. There's a greater public awareness of the DOH and public health, and I think that's because of our partnerships. Increased use of social media. Apparently it's here to stay, so let's take advantage of it and use it to our advantage. And then again, collaboration with other agencies is a opportunity that we see. So, and then finally moving on to our threats, and these are really the things that are beyond our control. And there's impacts the work we do, but not much you can do about it either. So, but how can we use our opportunities and our strengths to kind of work around the threats to do the work we need to do? And a lot of the top threats you're going to see are really resource directed. We have budgetary limitations, recruitment and retention of staff, and that may be because of salary or whatever it might be, or reduced revenue. So, but yeah, how do we take advantage of the opportunities to kind of address those threats? So, and then we provided an opportunity for just people to provide other comments. And I think where you're going to see is a lot of these are again focused on communication. So I think what we heard pretty clearly in the external SWOT or the internal SWOT is we need to do a better job communicating. So that's just a quick overview of the internal SWOT. And then moving on to the external SWOT, we also sent this was sent to, it was a group of 44 different individuals. It included legislators, tribal health, other state agencies. There were some Department of Health employees included. Some of our key partners, associations, like Hospital Association, Medical Association. And we had a 50% response rate there, again, so that's a pretty good rate. This differed in the sense that it was all open-ended questions, so people just had, free-form responses. So it's a little harder to categorize what they saw as strengths and weaknesses. The other thing about the external SWOT that's different than the internal is we asked, the internal one was specifically focused on the health department. The external SWOT was focused on the public health system in general. We weren't asking our partners to say, how do you think we're doing as a department? It's like, how do we work together to accomplish the things we need to do? So, again, I think what you're going to see come across as our strengths were similar to our department strengths. We have, a committed workforce. We're We work together just on day-to-day activities, but we work together to address emerging issues and threats. So, and then weaknesses, I think can kind of be tied a little bit to our communication as well as fragmentation of services. Are people aware of what everyone else is doing? We need to probably do a better job of communicating that. And then resources are showing up again as weaknesses just for the public health system in general too. So, and then the last slide is on the opportunities and threats. Again, how do we keep people healthy and reduce the cost of care? That's an opportunity that we have to work together in partnership with everyone to move forward on that. And then threats again are just health disparities in general. I mean, it's something that we know is out there and we have to figure out how to address and how that's done. So, but that I think covers what I was supposed to cover. And next.
All right. Thank you. So with that kind of a framework in mind, let's start to go through the strategic plan moving forward. What you're going to see here are some elements that are very similar, especially philosophically to what we've been working with here. But you're going to see a little bit, you're going to see some changes in language. So let's just walk through kind of the starting point of our strategic plan. The first is our vision, which you can see is outlined as healthy people, healthy communities, and healthy South Dakota. It's a lot of healthy, and we debated that, but we really felt it was important to really call out the fact that, we're working at the individual level to help individuals. A lot of you provide direct services to folks, and we wanted to make sure that our vision reflected the fact that you're helping people on an individual basis become healthy. We also do a lot of work at the community level. We talk a little bit sometimes about pure public health, and that's kind of where you see, community-based interventions come into play that we help support. And so we wanted the vision to encapsulate that. And then, of course, we're really, geared towards the health of our state as a state. And so that population health focus of healthy South Dakota we felt was an important part of our vision. Now, what is a vision? In its essence, it's really our preferred future. It should roll off the tongue. It should be something that really does in a very short number of words kind of encapsulate what we're about. And so I hope that resonates with you and the work that you do with the department. The next is our mission. This looks very similar to our current mission. So to promote, protect, and improve the health of every South Dakotan. I think every was really the change here from our current mission to the new mission. And again, that was just a reflection of the fact that we are concerned with and really want to impact everybody that lives in South Dakota, and just clarify that part there. The mission statement as part of our plan is really, really describes the purpose of our agency. And so whereas the vision is kind of what do we want to see happen, the mission is what are we about? And I think that, that mission statement does a good job of describing that. The next part here are our guiding principles, and again, conceptually, we've had guiding principles, and you'll see some of those come forward from the current plan. But these are really, agency value statements. I really challenge you all to look very hard at this list. If you can't see the screen very well, you have them in your handout. I hope they really resonate with you as a person. These are things that, you should feel very comfortable saying, yeah, I think we should be serving with integrity, eliminating health disparities, demonstrate leadership and accountability, focus on prevention and outcomes, leverage partnerships, and promoting innovation. These are things at the end of the day as value statements. No plan will ever cover everything that we do or want to do. No set of statutes or administrative rules or policy, memorandums ever really gets at every single thing that we do. And so when you're kind of at that crossroads of, I'm thinking through this issue, I've not dealt with it before, if you go back to your guiding principles and keep those in mind, you'll find the path forward that works in concert with our agency. So I hope these all resonate with you. They're going to be the foundation of our work in the next 5 years. With that, we're going to start to talk about our actual goals. So Tom Martinez is going to come forward and talk about our first one.
Good morning. Again, for those of you who don't know me, my name is Tom Martinez. You can see from the plan in front of you that we have 5 goals. And the first goal, which I'm going to walk through for you, deals with healthcare services. And as stated, the goal is to improve the quality, accessibility, and effective use of healthcare. So of course, this is a pretty basic concept that we can all agree on. Here in South Dakota, we want to have adequate access to healthcare services. We want those services, of course, to be of a high quality. And we want South Dakotans to effectively use those services. So you can see we have 3 objectives, A through C, under this goal. The first objective is really targeted towards addressing the issue of effectively utilizing healthcare services. We want to promote the right care at the right time in the right setting. So under this objective, you can see we have 3 specific strategies. We want to maximize the use of technology, as this will improve the quality of the healthcare being provided and will make the provision of those services more efficient. The second strategy is specific to prevention, which of course is key to public health. We want to increase the use of preventive services through awareness and education. And the last strategy is specific to the issue of antibiotic stewardship. In the United States, 23,000 people die every year from infections with antibiotic-resistant bacteria. So this strategy focuses on improving appropriate antibiotic use in South Dakota. The second objective under Goal 1, Objective B there, addresses the issue of accessibility. We want to sustain the healthcare services that we have here in South Dakota. You know, of course, we all know South Dakota is a very rural state. We don't have an overabundance of healthcare facilities or healthcare providers. So again, we want to maintain what we currently have. We propose to do this by focusing our efforts on 2 specific strategies. We need to focus on workforce to begin with. Without doctors, nurses, CNAs, the variety of other healthcare professionals, without them, South Dakotans won't have the access to healthcare services that they need. And of course, workforce is a huge issue, not just in South Dakota, but nationally. And with our aging population, the challenge workforce presents really is only going to get greater. So in our efforts to sustain healthcare services in South Dakota, we are going to focus on building and sustaining our healthcare workforce. Also in a rural state like ours, where we have limited resources, we need to be smart about how we provide healthcare services. So the second strategy proposes to support innovative ways to deliver healthcare. One example is obviously expanding the use of telemedicine across the state, which, and of course, this has ties to the first objective under this goal. Moving on to the last objective, Objective C, this gets to the issue of ensuring quality of healthcare services. This strategy is about providing effective oversight and assistance to ensure the delivery of quality healthcare services. The first strategy under this objective is specific to assisting healthcare facilities meet the established standards of care. And of course, this is nothing new to us. This is a core public health function that we do literally almost every day. We do this through the licensure and regulation of healthcare facilities, professionals, and services. And we need to continue to do this as it's a key means to ensuring that South Dakotans have access to good quality health care. Another way we can help ensure quality really is through the power of consumer choice, which is what the second strategy is geared towards. We want to make sure that South Dakotans have the information they need regarding the quality of the healthcare services that are available to them so that they can make the right choices for their individual situations. This next slide shows that we have, under goal number 1, we have 7 key performance measures. And of course the goal, again, is to improve the quality, accessibility, and effective use of healthcare. So these indicators, I'm not going to read them all to you, but they focus on increasing the use of resident-directed or person-centered care in our nursing homes. Focuses on reducing the use of antipsychotic medication in our long-term care facilities. Focuses on increasing the number of adults who receive routine health checkups. Focuses on increasing the number of healthcare facilities that receive clinical event notifications. Focuses on increasing the use of emergency telehealth services in our correctional health settings. It focuses on increasing the number of ambulance services that submit trip reports. And then lastly, the last performance measure focuses on increasing the number of physicians who choose to stay in the rural community that they serve through our recruitment assistance program. So again, goal 1, 7 key performance indicators. And now we'll move on to goal number 2.
Good morning. For those who are not familiar with me, I'm Linda Arndt, and I'm the administrator for Child and Family Services. And this is an area that I worked in as a part of strategic planning, so I'm excited to be able to share that with you. This goal, as you can see, is broad, and many of you in this room affect this goal. The focus is on prevention. It's on encouraging healthy behaviors for all ages across the lifespan. So it's an encompassing goal, which sometimes made it difficult to hone in on exactly what we wanted to do. Our first objective, as we looked at it, we wanted to reduce the infant mortality and improve the health of infants, child, and adolescents. And in this area, we know that we have much work to do in this area, specifically to improving pregnancy outcomes, infant mortality, and then healthier lifestyles for our children and adolescents. The first strategy that we looked at was looking at collaborating with our community partners on infant death review. And in this area, we're already working on work that we've done on both East and West River. We have review teams now working on infant death review, and we know that will just improve over the next years as we move that project forward. Also reducing infant mortality, as we talked about earlier, that definitely is a focus of our department, but also looking at that as a way to look at the health of our state and our nation. And in that area, we're also looking at safe sleep, prenatal care, also looking at tobacco use and reducing secondhand and third-hand smoke. Also, in the last strategy there is improving the overall health of children and adolescents. And there are many things that it's broad, and we do lots of work in this area. Efforts around reducing obesity, looking across as well to other factors such as immunization rates, tobacco use, increasing physical activity, and reducing accidental deaths. All of those areas will improve the health of our adolescents and children. The next objective is increasing prevention activities to reduce injuries. This is not necessarily new to what we do, but it will be a little bit new to how we're going to approach that. We'll be working with EMS and rural health, as well as our public safety partners and Department of Social Services to affect this one. And in the next years, we're going to be looking at data and also establishing some strategies under this particular objective. So we know reducing motor vehicle deaths is an important piece to affecting this particular objective. And then lastly, our last objective was prevent and reduce the burden of chronic disease. And again, there are many people affect this one, and there's much work that's being done in this area. Looking at strategies to increase the awareness and importance of recommended evidence-based preventive screenings. We're already working a lot in the cancer screening areas, but also looking at screening for blood pressure and diabetes. And also facilitating some of those evidence-based strategies that will improve screening, those being looking at the use of electronic medical records to do reminders and recalls for people to come in for screening. Also supporting policies that will enhance healthy nutrition and physical activity environments. This has been going on for a while, but specific focus on communities to establish policies around healthy foods, healthy vending, healthy concessions, and also in schools and work sites as well, and enhancing community work around walkability and environments where people are able to go out and walk safely. The next one, increasing the awareness and the dangers of tobacco use, promoting quitting, and changing attitudes and beliefs. You know, in that particular strategy area, we're going to continue the great work that's already been done with the South Dakota Quit Line. Also, all the media efforts that go around that as well, around public awareness, looking at disparate populations and reducing secondhand smoke exposure. And lastly, increase individual access to evidence-based education and lifestyle change programs. These programs are growing to assist individuals with their lifestyle change. We know that there are people out there struggling with chronic conditions that need some support, both with their medical care, but also when they go back to their communities. And that might be like the Health Home Project that Department of Social Services Medicaid leads, but also chronic disease self-management, Better Choices, Better Health, diabetes self-management, and diabetes prevention programs. The key indicators under this one, as it was difficult to decide what those strategies would be, it was equally difficult to pick the outcome measures and the key performance indicators because there's lots and lots of data under this area. So it's rich with data. So we picked some key indicators that will be the base, and there will be lots and lots of indicators behind these. But infant mortality, we talked about that being a key measure. It looks around at the overall health of our communities, our state, and our nation. Looking at breastfeeding data, and that one has many benefits. Can be in the reduction of obesity, healthy immune system for a baby as well. Looking at the percentage of school-age children and adolescents who are obese, this has been a long-standing data set and has stayed mostly stable, but the good news is we are seeing a little bit of change in our preschool children, so we look forward to seeing that measure improve over the next years. Then looking at child and teen death, accidental death rates. Again, this is one that we have the data on, and we're going to be moving towards looking at strategies to improve that data. And then looking at the percentage of adults who meet the recommended physical activity, again, helping people move more and looking at that as a way also to affect obesity rates and overall health. And then increasing adults who are up to date with their recommended colorectal cancer screening. This one is a national goal. You'll see lots of things happening over the next years around colorectal cancer screening. So it's not just a department goal, it's a goal across our state, and many of our partners are working in those goals. Thank you.
And I apologize, I should have, I should have introduced Linda and told you we're actually a person down this morning. Colleen Winter, this is actually Colleen Winter's part that Linda just did, and she's out unfortunately due to an injury she has. And we just found out this morning, so about an hour ago I was in Linda's office on my hands and knees begging and pleading for her to help us out with this, and of course she happily agreed, and thank you for that, Linda. Moving on to goal number 3. This goal focuses on public health threats, and as stated, we want to prepare for, respond to, and prevent public health threats. So we got 5 objectives under this goal. The first objective is to prevent and control infectious disease. This is another area that we're all very familiar with. Is communicable disease control is certainly a core public health function. How do we propose to achieve this objective? Well, the 2 specific strategies we identify deal with enhancing our disease surveillance system and improving our age-appropriate immunization rates. Again, this is pretty basic public health kind of stuff, but it's very important public health stuff, and we need to maintain our efforts in this regard. Objective number 2 pertains to enhancing our public health laboratory capacity. As stated, we want to build and maintain the state public health laboratory capacity and ensure a culture of safety within the lab. And as you can see from the 2 strategies that are listed, we propose to do this through employee education, training, testing, and updating our equipment, and enhancing our laboratory information management system, or our LIM system, for those of you who are familiar with that. We also want to utilize biosafety assessment tools to foster a culture of biosafety within both the lab and our clinical labs. And I have no idea what I just said in that last sentence, but I'm sure the lab folks know exactly what we're talking about here. Objective number 3, or objective C, represents our continued effort to develop a more robust environmental health program. Now, there's some history with this issue. In our last strategic plan that Kim went through, you might have noticed that, or you were aware of, that we specifically, in that plan, we specifically committed, and this was in 2010, to developing a dedicated environmental health program within the department. We come to find out this is much more complicated than it sounds. Easier said than done, so to speak. For a number of reasons, we admittedly haven't made much progress in this regard. However, we absolutely see a need for this type of expertise within the department. So in this plan, we're recommitting ourselves to that effort. And we're proposing, this time we're proposing to take a more incremental approach to the issue. Although it's not reflected in the plan, we recently added several environmental conditions to our reportable disease list. And here with this objective, we're going to work towards identifying the top hazardous environmental conditions in South Dakota. We're going to do this by assessing the need for this type of program, inventorying existing programs or activities. We actually do a fair amount of this kind of on a more informal basis in a number of programs in the department. And then ultimately, we're going to identify high impact unmet needs. And once we get to this point, we'll identify the best mechanism or mechanisms to address those unmet environmental health needs. The 4th objective focuses on how we respond to current and emerging public health threats. We want to strengthen these response efforts. We propose to do this through our continued development of our syndromic surveillance system, enhancing our regional preparedness partnerships, maintaining our public health stockpile, and becoming more proficient in detecting and identifying pathogens through our laboratory testing. The last objective, objective E, under this goal, pertains to the area of, or the issue of injury and illness prevention. We want to effectively use education and regulation to help protect South Dakotans from injury and illness. We want to become more efficient and effective with our regulatory activities through the use of electronic inspection systems. And we're certainly heading in this direction, and we've made some inroads to it, but we want to keep that momentum going, and that's why it's reflected in this plan. We also want to incorporate more timely and effective training in our work so that we can improve the quality of the work that we do in this regard. We also want to improve the communication with the industries that we regulate. This is absolutely key. Communication with our regulated industries or partners is absolutely key to ensuring a concerted effort. We all have the same goals in mind, which is the provision of, again, quality healthcare services to South Dakotans. And lastly, we want to continue our efforts to streamline and update our statutes and administrative rules. On this next slide, these are the key performance indicators for goal number 3, and admittedly, at first glance, it looks a little underwhelming. We only have 3. This is a good opportunity to make the point that, we've got a great start on a plan here, but it is a work in development. We intend to, as we move forward with this plan, we intend to modify it and augment it accordingly. So at some point in the future, I'd expect to see more key performance indicators regarding this particular goal, but so far this is what we have. We have 3 indicators that focus on increasing electronic disease reporting, focuses on increasing the vaccination rates for children aged 19 to 35 months, and then lastly focuses on building our syndromic surveillance capabilities by increasing the number of interfaces with our partner sites. So that wraps up goal number 3. I'll turn it over now to Kim to walk you through goal number 4.
Well, we're more than halfway through our goals, so the end is in sight. Let's talk about goal number 4. This does reflect kind of a newer way of approaching some of the work that we do in partnership with others as we move forward with our next strategic plan. Although certainly the need for partnership is very evident. We saw that come through on the SWOT analysis. We saw that as a strength of our agency. We saw external stakeholders really recognize our work in partnership, and so conceptually I don't think this is new at all, but we're calling it out a little bit differently in terms of the plan. So our goal here is to develop and strengthen strategic partnerships to improve public health. I think this really recognizes the complexity of some of the health related issues of our customers, and so the fact is that we cannot, as one agency, always really be the responding entity. We really, for certain issues, have to work in partnership with other agencies that can bring resources and expertise to some of the health issues that South Dakotans face. And so our first objective in this area is to reduce completed and attempted suicides through statewide and local efforts. If you've read the newspapers or seen any media here in the past few months, you'll see, particularly in Indian country, where we have very high rates of suicide happening right now. That is a public health issue, and so what can we do in partnership with other entities and other agencies and local communities to help bring about some solutions? In that vein, what can we do? Well, we feel like we can provide some more specific epidemiological support. Again, bringing one of the strengths of the department, which is our use of data, our collection of data, our ability to present data in a way that people can use and do something with it, is really going to be one of the strategies here. So we're bringing that support to local communities that are engaged in some of our statewide prevention efforts. This is an area, again, in following the media is kind of an interesting thing in this area. Oftentimes the data isn't right. How do we help people get the data right so they're building from a strong platform? We also want to look at other ways that we can use resources that we have today, such as the Health Information Exchange, so that we're getting data earlier in the process. We want to back up, again, with our guiding principles of preventing things from happening? How do we use some resources in this area to see situations when people are attempting suicide? How do we get better data from emergency room visits and really bring that to bear to build some solutions in this area? Our second objective in this goal area is to reduce the health impact of substance abuse and mental health disorders. You saw that come through on the SWOT analysis as well, and you saw about entities really, trying to make a difference, trying to help people, and finding barriers related to substance abuse and mental health disorders that people are struggling with. And so, how do we, add to the solutions in this arena? First of all, again, we're going to go back to our data. How do we really start to use and really implement more of a surveillance of substance use data that we already have or maybe need to get? How do we make sure that the information that we get on death certificates is good quality and is, in fact, really robust enough for us to be able to use that data in an effective way when substance abuse might be part of the issue there, or mental health issues? So, again, working in partnership, not the lead agency, but have something to contribute, and we'll be working in this area in the future. Our third area is where we really bring forward some of our work in health disparities. Again, not a new area for us, and again, the data really shows the need to pay attention to this. And so, to the degree that we see certain populations in our state that have poorer outcomes, we want to be able to collaborate with other partners to really address the health outcomes that people are facing. And so I think this is, certainly anticipated work with Department of Social Services at the state level, tribes at the local level. And this last point here is, how do we support tribal efforts to provide public health services to their members? Again, conceptually not new, but we're going to continue to really hone in on this and try to develop some innovative ways of helping tribes develop the capacity to provide health services to their members. Governor Dugard would say, and I echo this, government that's closest to the people is going to be the most effective at providing services that people need. And so in the case of tribes, we want to help them step up in this area if needed. We've got a number of key performance indicators in this area. Again, I think they follow along pretty closely to the objectives. We have a lot of data around suicide and the death rate and attempts, and so we want to see the suicide age-adjusted death rate move from 17.1 per 100,000 to the 12.6. That's the national suicide rate, and that's a big lift. That would be a significant reduction, and we debated in the context of our small group, which I was part of. That's why I'm up here talking about this one. I should have clarified that. We really debated, can we get there? And we, as a group, really said, why wouldn't we shoot for that? It might be hard to get there, but there's no reason we should see higher suicide rates in South Dakota than the national average. Or the national rate, excuse me. The second area there is to reduce suicide attempts with adolescents. And again, that's really going to be dependent on the data that we get from emergency rooms and how we help share that data and use that data effectively to get prevention and intervention programs in place, again, working in partnership with other agencies. We want to reduce the drug-induced age-adjusted death rate. You can tell Lon Keitlinger was a part of this group. I'm thinking about that now as I have a mouthful to say. So if you haven't worked with Lon, he's very passionate about all of these areas and really helped us get these right. But this third area is to reduce the drug-induced age-adjusted death rate for South Dakota. Again, these are preventable kinds of things. What can we do to help with some partnership kind of efforts to help reduce drug-related deaths? We also want to reduce the alcohol-induced age-adjusted death rate. A lot of this is going to come in some of that accident and injury data that we talked about earlier, and so we want to see some reductions there as well. The fifth area is relative to Native Americans, again, recognizing health disparities and wanting to see more Native Americans in our state self-report that their health status is good, okay, good or excellent. And so you'll see that called out. And then relative to disparities, it's not all about Native Americans. I think that's an easy way to kind of think about that, but we also see disparities in certain particular health related issues, and smoking is one of them. And so we wanted to call out that, you know, we see a higher rate of smoking among low-income South Dakotans, and so we called this out as a performance measure because we want to do some, you know, targeted interventions there to see a change in the disparity with that group. So we want to reduce the percent of low-income South Dakotans who currently smoke from 32.7% to 31.5%. So with that, we're going to segue to our last goal area. So Joan Adam will be here.
Good morning. As Kim said, my name is Joan Adam. I'm the Director of the Division of Administration, and I was part of Goal 5, maximize the effectiveness and strengthen the infrastructure of the Department of Health. As we worked through all of the goal areas in preparing the department's strategic plan, we realized that the work that we've outlined in goals 1 through 4 isn't going to be possible unless we do everything that's necessary to strengthen our workforce and give our employees the tools that they need to get the work done. Also, a lot of what you see in this goal is information that was identified and really brought out through the SWOT analysis, and really found value in the input that we received from the employees. For many of you in this room that are on the front line working with our customers, our constituents, the people in South Dakota, you know better than anyone what we need to have in order to deliver the services that we are responsible for. I think another important thing to remember about this goal is that this is really a goal where everybody should be able to identify in this goal, and everybody should be able to make an impact and really help us achieve the objectives that we've outlined here. Really, a message would be, don't wait for your manager or your leader to say, okay, let's start working on some of these areas. Really think about what these areas mean and their importance, and how you can make an impact here, and you can make the changes that are necessary to address some of the priority areas we've outlined. Number 1 was increasing effective communication. And we really, I think just through this process, realized the value of the input and the feedback that we were receiving from the employees as we were going through this process. Let's take that to the work we do every day and really provide opportunities for employee input and feedback on the work we do. There are ideas that are still being developed and generated around this area, but we want to take what we're doing even in these next 2 weeks in talking to the employees throughout the state and try to include some type of communication that we would do on an annual or maybe semi-annual basis with the department employees. We also want to be able to maximize the internet, the intranet that we all have access to as a central hub for department information. You may miss a staff meeting. You may not be able to keep up with the several hundreds of emails you receive individually. But if you had an area where you could go to follow up on key department information, that came through as a way that employees could really benefit. We're also, and changes have already been made, working to enhance the website, listserv, and webinar capability and use within the Department of Health. The other objective, promote a culture of organizational excellence. And this too is something each one of us can work very hard to achieve this objective. It's not only a personal objective, but it's also can be an objective that we work with as our offices or in collaboration with other offices throughout the department. Accreditation initiatives. We have programs, actual programs within the department that are already accredited. Correctional health is an example. Correctional health is accredited by a national accrediting body. But we're also looking at accreditation as a public health department. There is a accrediting body that actually accredits public health departments, of which South Dakota is currently not, and there may be good reason for that, but there may be goals that can be established by looking at the national accreditation standards. Within your own programs, there may be accreditation standards. So bring those ideas forward, share them with management. Establish an orientation and knowledge transfer plan for employees. What we realized is that some programs have very good and very thorough orientation programs and plans in place, and other offices, other programs don't have as well-defined orientation, but that it really comes through that orientation is one of the key things to developing and maintaining a good workforce. We've had examples in some of our direct line service areas where we were actually going to lose employees, and when we dug deeper into why they were thinking of leaving the department, it was because they didn't feel comfortable on the front line. And it was a relatively easy solution. Bring them back into orientation. Equip them with the knowledge and the tools necessary to do their job. And but as managers, unless you're hearing that feedback from the employees, that employees feel that they can be honest and say, I don't feel I received adequate orientation, as managers, you can't effectuate that change. Knowledge transfer plans. This became very evident, and you'll see also the, we have, well, I guess we call them the legacy documents. And this became very apparent through information that the Bureau of Human Resources shared with us throughout this process, is that we have a high percentage of Department of Health employees that are going to be retiring in the next 5 years. About 23%, I believe, was the number. And then if you stretch that out over 10 years, we have about almost 34% of employees that will be eligible for retirement. And we don't want to lose the knowledge and the legacy that those employees have built over their tenure with the Department of Health. We need to be able to capture that information and share it with the next group of employees that are coming through the door. We really want, and I know offices have already started on this, we really want employees to look at it from an individual level and think about what you do as an employee in your work for the Department of Health, that if you were, or in the future when you do turn your job over, what are the key parts of that position that others need to know about. Employee recognition. The secretaries, Department of Health Secretaries Awards. This has been something that has been in place in the department for many years. However, I think without that input that we received from all of you, that employee recognition is important. And we do, as employees of the department, want that to continue. We're in the midst of reviewing names that have been submitted, and you'll be hearing the Secretary's Awards being announced at some point. And there are also things that go on in individual offices in regards to employee recognition. And as managers, I think that's important to remember. Employees do appreciate recognition, even if it's just a personal contact with your employees. We also want to make sure we realize that the population, the complexion of the population that we're serving in South Dakota is changing. And we need to make sure that our employees feel comfortable in the jobs, that the very important work they do, again, I say on that front line, and that they are equipped with the training and the resources that they need. Again, a valuable display of how information from our employees to management can really help move in the right direction of the things that we need to be doing to help our employees. Also, I know this came through as threats and weaknesses in our SWOT analysis, but leveraging resources to accomplish the Department of Health's mission. I think in some ways we do this very well. We have certain grants that cross all divisions, the entire department in the work we do. And through the discussions that we have when applying for those funds or writing progress reports, I think we all learn a lot of the good work that's going on in other divisions and how that can help us in our respective divisions in the work we're doing. And we need to really continue that type of dialogue. And maybe it's not we're getting in together in the room because of a grant. Maybe we should just be getting together in the room with one of our colleagues that we know is working in a similar area from maybe a different angle, but how can we maximize and benefit the work that each of us is doing? And that goes right along with the innovative funding models and partnerships. Again, sharing the information that we have with each other to make sure we're maximizing funding sources, partnerships, and help turn some of those threats and weaknesses into opportunities for us as a department. Key performance indicators. I think this is another area too where we'll be seeing more or new different key performance indicators that will be developed. In some ways it was hard to wrap our arms and wrap data around what types of changes we were trying to make here, but I think the 4 that are listed dealing specifically with our internal communication, our orientation, the legacy documents, and the employee engagement surveys will be a good place to start, good place for all of us to really think about what can we make those numbers look like after implementing some of these objectives and strategies that have been outlined. With that, I am going to move on to our next steps. So, as I mentioned, some things are already going on in the department. Even before we've officially rolled out the strategic plan, I think many of the people that were involved in the plan, many of the people who we work with on a day-to-day basis, we've already started work towards some of these goals. Obviously, a lot of work went into developing the plan. And obviously, the department has a strong commitment to continue, really not just develop a plan and put it on a shelf and say, okay, we got that done, but use this plan to continue to guide, lead discussion, keep initiatives moving forward. And I think in that same vein, we will continue to refine and evolve, whether it be the key performance indicators or some of the other areas within the plan we'll continue to work on. Specifically, what's happening is, as I just mentioned, the key performance indicators for each goal, to continue to refine those and really use those performance indicators to track how are we doing? Are we making progress in the things that we've set out as a department? We also really want those key performance indicators to be tied to our goals and objectives and aligned to improving the outcomes for the people that the Department of Health serves. Not just a count of, oh, I've done this many or I've done that many of this training, but have we actually made a difference? What does the outcome look like? What is the health of our population looking like? And as has come through, I think, throughout the presentation today, is how important that data is to really help us evaluate the work that we do. Some of the activities and accomplishments. When I look truly at the internal strategies as well as the overall department goals, and that we've got partners that are key to making all of this happen, really at the end of the day, it does come down to there has to be a key staff member that is continuing to push the goals and the objectives that we've lined out here. And so you'll see that through the plan too, where staff have been designated to lead efforts for each strategy. We're also working the accomplishments report that is generated every year. Barb Bueller does a great job at listing this overwhelming amount of information that highlights accomplishments that are occurring in our many different offices and programs. I know many of you use that accomplishments list when you're reporting on grants, because you may have things that you have to report on that don't take place in your office, but you need information on accomplishments of others. However, what we're going to do now is, instead of reporting it by office, again, I think this might be something that helps break down the silos a little bit, is report those by goal area. Really tie those accomplishments back to our strategic plan. And a performance dashboard. We have, as you've seen, a lot of key performance indicators, but can we take a sampling of those performance indicators and provide more detailed information, not only for our employees, but also for the public that we serve. So at a glance, they can get a feel for what are some of the significant measures that the Department of Health monitors very closely, and further information on why those strategies and those key performance indicators are so important to the people of South Dakota. Okay, I'm going to turn it back to Kim for the next steps.
We're gonna just finish this up here, and I won't read these on the screen. You guys can all do that, but I would challenge you, and I would challenge you with the last two questions here. How do you incorporate the vision, mission, and guiding principles in the work that you do? I mean, think about that. I hope you're able to do that. How does the work that you do contribute to accomplishing the goals and the objectives of the department? If we got the plan right, you should all see how you individually help make these things happen, and I hope that's the case. If it's not the case, I want you to have a conversation with your supervisor to talk through that, because these are big things that we're trying to accomplish. I'm very confident that we'll get there, but it's only because of all of our efforts. It's not my efforts, it's not this group's, the management team's efforts. It's all of our efforts, working in partnership with others that will make good things happen for South Dakotans. So I want to thank you for your attention today. I want to thank you for the work that you do. I think we do awesome work as the South Dakota Department of Health. I'm really proud to be your cabinet secretary and to advocate for you on a daily basis. So, well, again, I want to thank you all on behalf of myself and our management team and the governor for the work that you do. Really appreciate it, and look forward to continuing to talk about the strategic plan, how we're doing, the strides that we're making, and the outcomes that we're seeing for people. So thank you for your work on that, and thanks for coming today.